I'm not sure that I'm a VIP, but
Yeah, of course.
there you go.
All right.
Thank you so much.
All right.
Real quick. How long after surgery will it take before GERD is usually considered resolved when looked at an endoscopy for you?
Well, it's like any wound. If it's completely cured, you can have the gastroesophageal reflux disease cured within days or weeks. On the other hand, it's variable. It depends on how much acid and how much the patient's eating and what medicines they're taking. So there's no kind of magic number.
Okay. Thank you.
All right, you want to say hi?
Hello.
Am I recording?
I think so.
Yes, here we are. Good. All right, say hi.
Good morning to everybody here in the room and everybody that's watching online. I had my surgery January the 17th, 2007, so just about 20 months ago now.
Yeah, that's right.
18, 20 months ago. And at my highest, which would have been in 2006, I was 370 pounds. When I came to see Dr. Rutledge, I weighed in at 343. I weighed myself this morning in preparation of coming here. I'm now 195.
Woo!
And I think I'm pretty much stable now. I think because in August I actually weighed myself as well, and I was very close to around the 195. I think I was around 197, just below 200. So I think I'm now at that plateau, and I feel it actually myself as well. It was, I don't know how to describe it. It was like a new lease on life for me. I was always active and athletic, but I was also carrying an extra 200 pounds, which actually was very difficult. And the surgery, much like what I heard today, it was very easier. It was easy. Not as easy as what I heard today, but it was very easy.
You had drains, right?
I had ports because I bled, I think, a little bit. Or it was more preventative, I think.
No, when we operate, we're cutting blood vessels. And so most of the time, and everybody here today was blessed in that basically when we cut everything, it stopped bleeding after we're done cutting because we staple it and sew it and things like that. But if you have some patients, they don't clot as well, or they're a bigger blood vessel, or the pinch is not tight enough. If any of those things happen, then you can have more bleeding than usual. And if that happens, then we put a little drain in. And so he had 2 plastic tubes coming out of his abdomen. They're very annoying, right?
They were.
They're real annoying.
It was really nasty.
And then he had to have those tubes for a week.
Yes.
And then came back to clinic, and they came out.
And they came out.
Yeah.
And the surgery, I think if I remember, it was somewhere around 25, 28 minutes. And I had roughly a 7-foot bypass. So, and I think that was more because of my size and because of my stature and so on and so forth. When I got back to Canada, I'm from Toronto. When I got back to Canada...
Wait. Yay, Canada!
Yay! When I was back in Toronto, it took about... To be honest, it took about 2 weeks for me to really, really get back to normal, like in order to feel the way that I did before the surgery. There were no complications whatsoever. I had no infections. I wasn't sick. I was just a little tired, and I think it was to what Dr. Rutledge said. I was stabbed 5 times, and I had had major surgery, and the body just needed to recover. By about mid-February, which would have been about, like I said, a couple of weeks after my surgery, I was fine. I was functional. I was back at work. I was walking moderately. I was just doing stuff that I had done before. I was just kind of even taking it easy. And 18 months later, I've had no issues whatsoever. I go for my checkups to my doctor. The blood work is awesome. You know, there's no problem with gastritis or with ulcers or any of those potentials that we're now at more risk with. And so for me it's been a phenomenal experience. I'm not sure where I would have been if I didn't consider this surgery. Have a safe trip back.
Thank you.
Oh, Canada.
I'm not sure where I would have been. I don't even know where I want to think about where I could or couldn't be. So you know, as a patient and as a friend to all of the people that are considering having this surgery, I think just you have to be very diligent, and you have to make sure that you do follow the rules. So I still, to this day, have 2 yogurts a day. I have my Metamucil. I make sure that I really pay attention, and maybe that's why I've had such an easy time at this, because it is easy to get caught in that trap where you feel that you are actually, you've lost the weight and you're just like, the next person next to you, but you really aren't. You've got some different wiring and some different circuitry inside that I really don't understand, but I learned about. I took my first semester in medical school when I had to take this, when I applied for this surgery. And so I learned enough to help myself, but I also learned enough to not harm myself by getting caught in that trap. So I stay away from the risky foods. I practice as much as I can. I have not had a cup of coffee since 2 years now. I mean, I got rid of
green tea.
I have not had a drop of alcohol. I mean, I really try to pay attention, and it's hard. But you know what? In the grander scheme of things, 200 pounds, a cup of coffee. I'm glad to have lost the 180 or the 200 pounds that. Roughly that I'm at, and it's been wonderful, and I'm here to play my tennis tournament again this year.
Good luck.
Thank you so much.
All
Last
right.
year I was here, and for those that don't remember, I actually won the tennis tournament last year. So
Pretty cool.
we'll see how it goes. So I didn't have I've been here actually since last week. I didn't have a chance to make it to last week's clinic, so I thought.
Yeah, because now you're such a star.
I'm not a star, not a star. Actually, I got caught over there by the one-armed bandit, and he wouldn't let me go, so that was the problem.
That's okay. He's depositing money for our schools. And
There you go, see? But just to anybody that's online or anybody here in the room, or if you have friends or family that are maybe considering, I always volunteer. I'm happy to be a sponsor or the referral. If anybody ever wants to talk to me, I participate on the CLOS.net chat groups, and I'm happy to help because it really will change your life. But you have to do it the right way, and you really have to follow the rules. That's my advice.
Thank you very much. Great. You look wonderful.
Thank you.
Great.
Thank you.